right, everyone, would you like to go ahead and turn your cameras on to get ready? Okay, it is now noon, so we're going to go ahead and get started. Good afternoon to all of my speakers, and good afternoon to everyone who is joining us for this media briefing. This is the Los Angeles County Department of Public Health, and this is a media briefing on monkeypox. Today presenting, we have Dr. Rita Singal, Chief Medical Officer, Dr. Dawn Terashita, Associate Director of Acute Communicable Disease Control Program, Dr. Andrea Kim, Director of Vaccine Preventable Disease Control Acute Communicable Disease Control Program, and Dr. Leo Moore, Medical Director for Clinic Services, SPAs 1 through 4. Our presenters will be showing some slides around our update on monkeypox, and then they will be taking your questions. As a reminder, as we do in all of our media briefings, you may chat me, the host, to ask your question, or you may use the hand raise icon. All right, let's go ahead and get started with our first speaker.
Thank you so much. Good afternoon. Thank you for taking the time to join us for this media briefing. As you just heard, my name is Dr. Rita Singal. I serve as the Chief Medical Officer of the Los Angeles County Department of Public Health. I'm joined by several of my colleagues today who were just introduced. Dr. Dawn Terashita, the Associate Director of the Acute Communicable Disease Control Program, Dr. Leo Moore, the Director of Clinic Services for Service Planning Areas 1 through 4, and Dr. Andrea Kim, who's the Director of Vaccine Preventable Disease Control Program. So on this call, we will provide you with a situational update on monkeypox in LA County, some background on the virus itself, how we're working with the community, and information on the recent expansion of eligibility of the monkeypox vaccine. I'll go ahead and take the first slide. As of July 7th, there are over 7,500 worldwide confirmed cases of monkeypox across more than 57 countries. This includes 700 confirmed cases in the United States from 36 states, including 141 cases in California. The World Health Organization is reportedly planning in mid-July to reassess whether the outbreak constitutes a public health emergency of international concern. There have been 3 deaths reported internationally, but no deaths have occurred in the United States. Monkeypox is a disease caused by infection with the monkeypox virus. What makes this situation remarkable is that it is usually found in Central and West Africa and does not occur naturally in the United States and other countries where current cases are being reported. I want to be clear that the risk of monkeypox in the general population remains very low based on the information we currently have available. To date, there have been 54 cases of monkeypox identified in LA County. The Los Angeles County Department of Public Health has confirmed local transmission of monkeypox, as some of the recent LA County cases report no history of either international or out-of-state travel. I want to emphasize that there have been no hospitalizations or deaths locally. As with any outbreak, public health is investigating cases and conducting contact tracing to learn more about how widespread the virus is in our community. And now I'd like to turn it over to my colleague, Dr. Dawn Terashita, to provide some background about monkeypox.
Thank you, Dr. Singal. Next slide, please. Since monkeypox is rarely found in countries like the United States, we wanted to share some general background information about the virus itself. Monkeypox is a viral infection. The predominant mode of spread is through contact with body fluids, monkeypox sores, or shared items such as clothing and bedding that have been contaminated with fluid or sores of a person with monkeypox. Monkeypox virus can also spread between people through saliva or respiratory droplets, typically between people in a close setting. Although monkeypox is generally not considered a sexually transmitted infection, it can be transmitted during sex through skin-to-skin and other intimate contact, regardless of gender or sexual orientation. Next slide, please. People with monkeypox sometimes develop a flu-like illness with fever, fatigue, muscle aches, and enlarged lymph nodes followed by a rash. In many instances with the current outbreak, people are developing a rash with or without other symptoms, and this rash is often focused in the genital region. People usually develop monkeypox 7 to 14 days and up to 21 days after being exposed. Most people with monkeypox have a mild illness that improves without treatment over 2 to 4 weeks. Treatment is supportive and focused on easing the symptoms of the illness. Monkeypox is contagious and can spread to others until scabs have fallen off and a new layer of skin has formed. As a reminder, there are no specific approved treatments for monkeypox infections. However, medication such as antivirals may be used to ease the symptoms of illness. In some cases, vaccine, which Dr. Kim will lay out shortly, can be given to prevent the disease after exposure to monkeypox. Anyone who thinks they might have monkeypox should contact their healthcare provider. Anyone who doesn't have a provider or health insurance can call 211 or visit a public health sexual health clinic near you. If you are sick and could have monkeypox, it is recommended that you isolate and delay travel by public transportation until you have been cleared by a healthcare professional or public health officials. Now to Dr. Moore.
Thank you, Dr. Terashita. I'll take the next slide. To prevent the spread of monkeypox in Los Angeles County, we ask individuals to be aware of the risks and how monkeypox spreads. It is also important to remember that monkeypox can spread through sexual networks. As such, and until we learn more, we urge you to be vigilant and protect yourself. Additional steps include avoiding contact with materials like bedding and clothing that has been in contact with a sick animal or person infected with this virus, avoiding contact with people who are or may be sick with the virus, and avoiding contact with animals that could have the virus, such as animals that are sick or that have been found dead. Wash hands with soap and water or use an alcohol-based hand sanitizer after contact with infected animals or humans. I'll take the next slide. Public health has also done a lot of work to share information on monkeypox with community and healthcare providers and the general public. To date, we've held nearly 10 telebriefing or coordination calls with community partners, including the HIV community, LGBT community, people experiencing homelessness, sex workers, elected officials, and service providers, and are disseminating a variety of assets and materials for these partners to share with their clients or the public, including printed postcards and pamphlets. Additionally, we're hearing more and more that monkeypox information is more likely to be consumed by the communities we need to reach on social media platforms like Instagram and TikTok. So public health is working with local LGBT social media influencers to serve as trusted messengers and share information about monkeypox to their followers. I'll take the next slide. I also want to promote that public health will be participating with a number of community partners, including the Los Angeles Blade and the LGBT Center for a virtual town hall event next Tuesday at 6 p.m. At the event, we'll be presenting information about monkeypox and directly answering resident questions. And finally, I want to encourage residents to sign up for the Public Health Monkeypox email newsletter, which will be delivered weekly directly to your email address. I'll take the next slide. Public health is also sharing information with our healthcare provider partners across the county. Monkeypox infection should be considered for patients presenting with skin lesions, especially for those with a history of recent travel to an area with confirmed monkeypox cases. If lesions are characteristic for monkeypox, monkeypox should be considered even in the absence of known travel. Those who have known close personal contact with people with monkeypox could potentially also be at risk for the disease. We also encourage healthcare partners to take note that some patients have had genital lesions and the rash may be hard to distinguish from syphilis, herpes simplex virus infection, chancroid, varicella zoster, and other more common infections. They should also isolate any patients suspected of having monkeypox in a single person room and ensure staff understand the importance of wearing appropriate personal protective equipment, including a gown, gloves, eye protection, and respirator, and that they wear it each time they're near suspected cases. Healthcare staff should also use standard cleaning and disinfectants in accordance with the manufacturer's instructions. And finally, all suspected monkeypox cases should be reported to public health immediately. Thank you. And now I'd like to turn it over to Dr. Andrea Kim.
Thank you, Dr. Moore. I will take the next slide. So to begin, I want to briefly cover what public health has done to date on the vaccination front. As mentioned previously, the supply of vaccine from the federal government has been extremely limited. Our initial allocation was 1,000 doses, which we quickly administered over the last several weeks to those at high risk. And as a reminder, those who received a single dose of vaccine will need a second dose 4 weeks later. So that is also being accounted for in our supply. We are really happy to report that this week we received an additional 6,000 doses from the federal government, and the plan is to continue to allot these to groups at highest risk of monkeypox exposure. Next slide, please. So with the arrival of the additional 6,000 doses this week, beginning on Monday, July 11th, we are happy to report that we'll be expanding the eligibility criteria for residents to receive the monkeypox vaccine. Due to our continued limited supply from the federal government, vaccine is being allocated to residents at highest risk of exposure in stages, as well as in alignment with the National Monkeypox Vaccine Strategy. So public health will continue to provide monkeypox vaccines by invitation only to the following select groups of persons identified through public health investigation. This includes persons who are confirmed by public health to have had high or intermediate risk contact with someone with monkeypox as defined by CDC. Also, persons who attended an event where there was a high risk of exposure to an individual or individuals with confirmed monkeypox through skin-to-skin or sexual contact. So public health is working closely with these event organizers to identify persons who may have been present and at risk of exposure while at the event. Beginning on Monday, monkeypox vaccines will become available by invitation only to 2 additional high-risk groups. First, patients of community sexual health clinics, public health centers, and other community clinics located across LA County who meet the following clinical criteria. Gay and bisexual men and transgender women who are patients of sexual health clinics with a diagnosis of rectal gonorrhea or early syphilis within the past 3 months, as both these sexually transmitted infections can increase the risk of monkeypox transmission through the genital sores that are caused by these infections. And second, a limited number of high-risk individuals identified by clinical staff at Men's Central Jail. It's important to emphasize that vaccine will be available by invitation only, and that public health or clinic partners will directly communicate to eligible patients to provide the details on how and where to access the vaccine. Residents who have not been contacted by public health or clinic partners will not be able to be vaccinated at this time due to our limited supply. Next slide, please. So perhaps the question we get most is when vaccine eligibility will expand even further. We understand this concern, but I want to reiterate that the risk of getting monkeypox in LA County is very low. That said, with the Genius vaccine supply extremely limited in the US, residents who have not been contacted by public health or clinic partners are not able to be vaccinated at this time. But public health is going to be expanding eligibility as additional doses are available. We anticipate that the federal government will distribute additional doses later this month. To find updates on eligibility, please visit public health website at ph.laccounty.gov/media/monkeypox. Thank you, and I believe now we will start taking some questions.
Thank you to all our speakers. As a reminder, if you have a question, please use the hand raise icon, or you may chat me, the host. Our first question comes from Jackie Fortier from KPCC. Jackie, you are unmuted. Go ahead.
Hey folks, thank you so much for answering our questions. I appreciate it. I have a few. You put emphasis on animals. Have we had any animals test positive for monkeypox? And then I would like to know, I mean, other large metro areas like New York City and Washington, D.C. are offering vaccinations to any adult in certain high-risk groups, and they've gotten about the same number. New York, anyway, has gotten the same number of, vaccines that we have, a little less, but not much. So can you please explain why, in LA it's only by invitation only, as you say? And then I was also wondering if you're offering vaccines to health workers in those clinics. And how many people have received the Jynneos vaccine in LA County? Thank you.
Dr. Tershita, could I ask you to please take the question on the animals? I think providing a little bit of history on what we know about monkeypox in the past.
Yeah, in the current outbreak, we have not seen any cases associated with animals. However, in previous outbreaks, we have. And the last big outbreak that occurred in the United States was around 2003, 2004, like over a decade ago, but it was associated with Gambian rats and prairie dogs. You may remember this. And so because animals can get monkeypox and because they have been in the past a big risk factor and continue to be a big risk factor in endemic countries, we mention animals, but you're correct. In this current outbreak, we have not seen any animals to date.
Dr. Singal, should I answer the questions on the vaccines? Okay, and I hope I catch all of them. So really good point. I mean, we have been closely watching the experiences of our sister jurisdictions and really learning from those experiences. And I think here in LA County, what's different is we really want to ensure that we're able to offer the vaccine in an equitable way for those at highest risk of monkeypox. So here we've taken a much more targeted risk-based approach. We've looked at the risk factors, we looked at the epi, and we really want to be partnering with our community clinics because it's our community sexual health clinics that really know who serve MSM and transgender women. They know their clientele. So we really want to be working with them to integrate the vaccine into their routine clinical care. So much more targeted approach. And again, we want to disperse this across the county. So definitely different from our sister jurisdictions, but we will learn as we go into this next phase on Monday. In terms of how many vaccines we've administered to date, it's been about 1,000.
Thanks, Dr. Kim. And I think there was a question also about whether we're going to be extending vaccination to healthcare workers, and that's something that we will continue to assess. What we have seen so far is that the risk to healthcare workers has been very, very low. We have not identified any cases among healthcare workers yet, and so we will continue to have those discussions with our providers and those that feel that they are at high risk and are requesting vaccine. We will definitely be considering that.
Our next question comes from Stephanie Dazio at the Associated Press. Stephanie, you're unmuted. Go ahead.
Sure, thank you. In regards to the 54 cases in the LA County area, are they believed to all be related or some of them? If there's no international or out-of-state travel, can you link where they originated from or basically how they got here? Thanks.
Dr. Tershita, you want to try and answer that difficult question?
It is a good question. As we've all heard in the news, there's been a lot of linkage of this current monkeypox outbreaks to both travel internationally as well as domestically. There's now outbreaks occurring in many, many areas of the world. So it is one of the questions that we ask every case. So in our current case count, we do see many cases associated with travel. We also see cases that aren't associated with travel, and we announced we had some local spread maybe a couple weeks ago. So we attempt to link cases with every case. We are not always successful, as this is a very difficult task, as you can imagine, but it is a very good point. I'm sorry, did I miss part of that question?
I think that's good, Dr. Tarshid. I think what it is we do our best when we have any new cases of doing a very intense interview process to try and identify where what contact or exposures may have happened. And we're not always going to be able to link all the cases to other cases. And we can say very clearly that all of those that are representing local transmission have not all been linked together, but there may be a few that are linked here or there. They may be associated with an event, a venue, and that is when we will act on that, and we will then take steps to make sure that we are messaging out to others that may have been exposed in that area.
Our next question comes from Emily Dugdale from KPCC LAist. Emily, you're unmuted. Go ahead.
Hi, I had a question about the monkeypox vaccine in custody settings. So how many people at Men's Central Jail will be offered the monkeypox vaccine? Are incarcerated folks in other jails also being evaluated for consideration for the vaccine? And then most importantly, have there been in custody confirmed monkeypox cases? Thank you.
So I'll take the first part of that question. So we expect that there are a couple hundred persons in Men's Central Jail that may be eligible. And again, we are really looking at this based on risk factors and the epidemiology. And so we really want to be focusing on, the profile of cases that, across, the US. And so about a couple hundred that we feel that would be eligible for vaccine. And beyond that, I think if they do have other behavioral high risk factors, then we would be considering offering the vaccine to others within that Men's Central Jail.
And on the,
Sorry,
go ahead, Dr.
Single.
Sure. On the other question regarding any cases that we may have seen. So I was going to ask Dr. Tarshida to confirm, but of the cases that we've investigated, so this is an ongoing process. So we have new cases that are coming in on a daily basis, and investigations are ongoing. So of the ones that we have investigated, we have not had any that are in that population yet, but that is something that is an ongoing process. The investigations are ongoing.
Our next question comes from Ron Lin from the LA Times. Ron, you're unmuted. Go ahead.
Hi, everyone. Thanks for doing this call today. Really appreciate it. I have 3 questions on monkeypox and one on COVID. First, the sense that I'm getting is that there's major demand for vaccinations and frustration that enough aren't available. If people can get a vaccine, like the first dose, how protected are they once they get the first shot? If they haven't gotten monkeypox yet, do they have some protection? And if they do get a significant degree of protection, should the emphasis be on getting more first doses out and delaying second doses? Number 2 is, for people who can't get the vaccine immediately, and people are sexually active, and for those who are at higher exposure, given what we know, what advice can you give them to reduce risk? 3, do you have a sense on where monkeypox clusters are occurring? Are they occurring in specific areas such as West Hollywood? That came up in a call earlier this week. And then finally, a question on COVID. I know there's been advice that people should consider masking in crowded outdoor public spaces, given what we know about the increased contagiousness of BA4 and BA5. Is masking outdoors more important now? Thank you.
Maybe I'll take the first part of that. It's a great question. This question comes up on, how protected are you with that first dose? I don't think we have enough data to actually answer that question. What we do know is that this is a 2-dose series, so we are reserving that second dose for anyone that did receive that first dose. I think in terms of the supply, though we are in limited supply, HHS has really been committed to letting us know that much more is coming our way. So I don't think we'll be in the situation of very limited supply in the next coming months. So I think by the end of the year, it's projected that we will have millions of doses available of Genius. But already there is a second allotment that we're expecting to come in the next week or two, and there's going to be phases with that. There'll be next week or two. There will be another allotment in late July, another one in August, and so on and so forth. So our guidance right now is a 2-dose series.
Dr. Terashita or Dr. Moore, you want to talk about how to decrease risk? I think that was covered in.
Yeah, I think this is actually probably the most important message we have to give today. There's nothing about the vaccine that's magical. Even if you have the full two-dose course series, it's only shown to be about 85% protective. It is not 100%, and it shouldn't be thought of as like some sort of 100% protective measure. Everyone should always take precautions to prevent disease transmission. Again, this disease is mainly skin to skin transmitted. It's from close contact, often intimate contact, often mucous membranes. So given that, measures to prevent infection are what ought to be communicated to our community. If you've been exposed, yes, you should get the vaccine. But if you haven't gotten the vaccine, there's other things you should do to protect yourself. Try to isolate yourself as much as possible to prevent spreading the disease to others. Make sure you monitor yourself for signs of early illness, perhaps fever, fatigue, or any sort of rashes. And as soon as you have any symptoms, then definitely isolate yourself. The good news is that this is a relatively mild disease. Again, there's been no hospitalizations and no deaths locally, and even worldwide, very, very few hospitalizations and no deaths. So it's a mild illness that lasts a few weeks, and then most individuals get perfectly 100% better. I would also like to offer Dr. Moore a chance to answer.
Thanks, Dr. Terashita. And just to add to your answer, if a person develops a rash, then we would want them to isolate, but we're also encouraging them to either come into a sexual health clinic or go to their primary care provider to be tested for monkeypox. Thanks.
Thanks, Dr. Moore. And then maybe I could just take the COVID question, Dr. Singal?
Sure, that'd be great.
Yes, and I know this is a presentation today on monkeypox, but always good to throw in a COVID question. Yes, as you commented, our numbers of COVID infections have been going up, and we definitely see an increased proportion of BA.4 and BA.5. And yes, wearing masks has been shown time and time again to be protective, both indoors and outdoors. I think it's a good time to start reinforcing this, putting that message out there. And as a side, since we're talking about monkeypox, it will also be protective for monkeypox.
Thanks so much, Dr. Terashita. So there was one other question in there, Ron, I think, around clusters and specific areas where we're seeing cases. So, I can say to you right now that this is, of course, something that we're tracking very closely. We have a very small number of cases right now, overall, when it comes to kind of looking at things geographically. And so it is hard for us to say that if there are specific areas that are being impacted. We are seeing cases across the county. I think our message, is very clear that anyone can get monkeypox. And so I think it's, that's what we're going to be focusing on right now. As we get more cases and we have more data, we will be sharing out more information about the cases. But for now, just given the small numbers and the confidentiality issues that, we're not going to get into any of those details.
Our next question comes from Grace Tui from the LA Times. Grace, you're unmuted. Go ahead.
Hi, thank you so much for taking our questions. I had a few questions about monkeypox. The first that I was hoping to hear about, you mentioned, coming in to get a test. I know that testing infrastructure was an issue early on. Do we know, I guess at this point, do you guys feel like there is, robust enough testing infrastructure that if people are concerned, they can come in early on to get testing? And like at what stage should they be coming in? And then I was also curious, you mentioned you were working with sexual health clinics. Is there specific clinics across the county that you guys are working with? Or, are you going to be reaching out to all different sexual health clinics? Like if, are people going to be able to go in and find the resources that they need? And then I was also curious if high-risk patients would be included in HIV positive patients. Is that a group that you guys are targeting with the vaccines as well? Thank you.
Thank you so much for those questions. So I can start with the first one regarding testing infrastructure, and I would love for Dr. Terashita to add in as well. So I think this is a very good question. So what we have seen over this last week especially is that there's been a definite large increase in requests for testing. Right now, the Department of Public Health Lab is one of the LRN designated labs that can do the testing for orthopox virus. We continue to test on a daily basis at the Public Health Lab. And, we do anticipate that we're going to be, reaching a capacity there. And so we are very happy to hear what was announced just a couple of days ago that LabCorp, which is one of the is the first of 5 commercial labs that are going to be coming on board to expand testing capacity, that LabCorp is now on board. And so we are going to be messaging out actively to our providers to let them know that this is an option. And for those that can send out their samples to LabCorp, we're hoping to make sure that we leverage that new resource. We are also hearing that as part of the federal strategy, that the 4 other commercial labs will be coming on board in the next couple weeks. And so we're just waiting for that to happen as well. I can say that the testing capacity, then the infrastructure, I mean, we are moving ahead with testing on a daily basis. We encourage anybody that has any symptoms, any lesions to go in and see their provider. We will collect samples, they will come to our lab, and we will get to them and get them tested. And so it should not hold anyone back from coming in if they have symptoms.
Yeah, I just wanted to add, Dr. Singal, that actually we've been very proud of our testing capability here in LA County. We have not run out of testing. We have tested everyone who has met the CDC definition for testing. Yes, we've gotten a large volume of tests, and yes, sometimes the process is a little slower, but we have been able to continue with that capacity. And we think now that commercial labs are coming on board, we think we will have plenty of testing capacity moving forward.
Why don't I answer the questions about the clinic? So we are partnering up with sexual health clinics that provide clinical services to gay and bisexual and transgender women. So those are the clinics that we are partnering up with. And as I mentioned earlier, we really want these clinics to be able to integrate the vaccine into their routine clinical care for sustainability. These centers know their populations well, and so we really want to, let them, really provide the care for their patient populations. Many of these clinics have HIV positive patients. So, with our eligibility criteria, there definitely are going to be included. And as we expand, there's going to be much more, coverage around the immunosuppressed as well as others that have behavioral risk factors once there's more supply vaccine. Thank you.
All right, thank you so much to everyone who joined us today, and thank you to all of our speakers who joined us as well. As a reminder, additional media questions can be sent to our media inbox at media@ph.lacounty.gov. Once again, thank you to everyone for joining us.